This test is a quad rock test. So we're doing this test to observe scapular stabilization in our patient. So I start by having my patient on all fours. Their hands should be under their shoulders, their knees under their hips. What I'm going to ask my patient to do then is to rock forward and backward. I'm going to have my patient do that about 3 to 5 times. So they'll rock forward and backward. And what I'm looking for is a prominence of the medial border of the scapula. If this is a motion that my patient is able to do with no issue, then I'll have my patient stabilized again, and then I'm going to have them rock side to side. Here I'm further challenging that scapular stabilization, and again looking for that medial border prominence. If my patient is able to do this with no issue, then I'll progress this test a little bit more. I'll have them lean forward and then move side to side. And that should significantly challenge that scapular stabilization and induce even a little bit more winging. Good, relax. What we're calling scapular winging here is an entire prominent medial border. So from the superior to the inferior aspect of that scapula, that entire border then would be visible, would be prominent, would not be against that thoracic cage to complete that scapulothoracic joint. We need that stabilization for adequate shoulder function, and this is something that we typically see in an individual who has an upper cross type of syndrome. So this is a test that, again, I would use when diagnosing an upper cross patient.